Hello, everyone, and welcome to today's webinar of Evidence-Based Future Healthcare. My name is Lucy Heaney. I am from the International Office here at University of Galway. Today, I am joined by Dr. Elaine Toomey and Dr. Emer Morrissey. And before we go ahead, I'll just do a little bit of housekeeping. On the right-hand side of your screen, you will see a live chat where you can ask any questions about the presentation or about the course or about the university, and we will answer them. For privacy issues, we don't allow email addresses or social media links or WhatsApp numbers, just for your own privacy and safety, but we will try to answer anything you have, and you can also ask questions on this platform after the webinar. Thank you very much. I'll hand over to you, Elaine.
Thanks very much, Lucy. So hi everyone, my name is Elaine Toomey and I'm the Programme Director, co-director of this new Masters, and I'm delighted to have Emer Morrissey here with me as well, who's a lecturer on the course as well. So I suppose what we wanted to do today was just to talk to you about our programme. So many of you have been in contact with us already, which is brilliant, but I think it's kind of good to kind of just hear from the horse's mouth, as I'm calling myself a horse, just about the programme, a little bit about why we developed it and how excited we are to have you joining us in September. And if you're not sure yet, to hopefully that this might help you make up your mind. So further ado, then I'll kick off. So just to kind of mention that we've extended our closing date for applications to July 31st, just to give people a bit more time for funding and that kind of thing to get that in place. So just to, I suppose, give an overview of why we kind of set this course up in the first place. So we're healthcare professionals by background. So I'm a physiotherapist. Declan Devan, who's the other co-program director, is a midwife. And I suppose we've been working in this kind of space of evidence-based healthcare for some time now. But particularly we've been seeing, in the last, recent times, really, I suppose, the very changing face of what healthcare is looking like and what it's going to look like coming down the line. So I suppose often, a lot of us are probably already aware, but things like, AI can now read an X-ray potentially better than humans, or things like that. We are seeing so much more with the increase of digitization of healthcare, so much more data available both to patients themselves, but also to healthcare professionals. And what do we do with that? How do we make the best use of that? Also, increasing volumes of healthcare research makes it really hard to keep up to date in terms of what's going on. So, and also then I suppose the COVID pandemic really shone a spotlight on the importance of evidence-based healthcare, but also the importance for everyone to be aware of it and how to use it. So the public making informed healthcare decisions, healthcare professionals to be able to help their patients make informed decisions and to facilitate that piece, and also healthcare policy making as well. So we set this course up, I suppose, as a way to really try and provide healthcare workers from all backgrounds, so open to people with, backgrounds in providing direct provision, as well as people working in admin, policy, research, all those types of areas, but really to provide people with the skills and knowledge to and apply an evidence-based lens to their decision making, to address these current and emerging healthcare challenges. So what the course looks like today might be very different to what it looks like next year, or the 2 years after, or 5 years down the line. So that's our point, is to kind of keep revising and reviewing and updating the program so that the program changes and moves with the challenges as they change. We aim to use cutting edge approaches to evidence identification, appraisal and implementation in conjunction with people receiving care. So that's what we're trying to help people do within their work settings. And our goal is really overall to transform current practice and to optimise healthcare outcomes. So in terms of the key features to the program, so it's a fully online course, which we really wanted to have, I suppose, in order to enable flexibility of learning. So we think the most people that we want to try and target with this course are people who are working in healthcare environments as it is, and who mightn't have the capacity or the ability to take, full time off to do this course full time, or to come to the university campus to do it. We also recognise that there's so much that can be learned from different countries and different healthcare settings. So we wanted to make this as accessible to an international audience as well as a national audience. So it's fully online learning, so you can do the course from wherever you're based, whether you're in Donegal or in Ethiopia. And that's really important to us to get those different views and experiences. You can do the course 1 year full-time if you are lucky enough to be able to take that time off, but also you can do it 2 years part-time. And as I say, we've developed it with people working in mind, and I'll talk a little bit more more about how the course is structured and how it actually works in reality, so you can see what I mean. Each module and assessment is also highly applied to real-world settings. So we want people to come out of this with something that they can use in their practice tomorrow and really to make a difference to their current work. It's also interprofessional and interdisciplinary. So as I've said, the two program directors were from very different backgrounds, but also the staff that I'll introduce shortly as well. And we really want to reflect that then in the people who come onto the course, that we're really trying to reflect what a healthcare system would look like, where it's lots of different people, lots of different disciplines trying to work together to solve similar issues. It's also a high quality training offering. So we put a lot of work, and still putting a lot of work into making sure that the course is very interactive. Despite the fact that it's online, we do want that interactive piece to be, and that's really important to us. So we have a variety of delivery modes, and it's specifically designed for online. So I think a lot of people who might have done online or distance learning courses before might feel, it's death by Zoom, or it's everyone comes online and it's, a narrated PowerPoint or whatever. So we're not taking that approach. We've worked very closely with our educational technologists in the university and elsewhere to try and make sure that this is designed specifically to be online, so that it works well and it is interactive and engaging. We also have an official partnership with Cochrane Ireland and Evidence Synthesis Ireland, who are based in the university. So Declan is the director of Cochrane Ireland and Evidence Synthesis Ireland, and myself and Emer are research associates with them. So we're this is, I suppose, to enable that our quality of our training is really a high quality delivering. We also have guest contributions from international experts, and that's as a result of the international connections that we already have in the work that we do currently. So this is just a quick snapshot of our modules and what the programme looks like. So the first module is an introduction to evidence-based healthcare. So this is really where we take you through what the principles and the kind of underpinning, what it means and what it looks like in the current healthcare environment, what evidence-based healthcare is, I suppose. Then we have foundations of research and healthcare modules. This is really about understanding what the different types of research studies and designs are, and what types of questions you can ask, and how to ask a question, then how to propose an answer. And what I mean by, I suppose, applied assessments is that, say, for our assessment for this module, you'd be developing a research plan in terms of starting off from your research question, shaping what that looks like, picking an appropriate design, looking then at what are the key quality features of that type of design. For our next module then is about really trying to find the evidence, how to synthesize it and appraise it. So this is kind of like your evidence synthesis, systematic review type module. However, while we'll teach you how to do and what the steps of a systematic review are, the assignment is more of an applied rapid review methodology. So you could have your question about, well, does say from a COVID-19 example, does hydrochloroquine work to prevent COVID-19? And then we would train you then how to go and find the answer to that question in a rapid way, but understanding what are the caveats in making it that fast, what are the things we need to be aware of, and how do we communicate that to our audience and to our patients or to the public. Our stats module then is a practical approach. So rather than teaching you how to, say, run a t-test, we're going to be teaching you what a t-test is, what it means for the patient sitting in front of you, how to read it and interpret in the research that you come across, and really then about decision making. How do you factor it into decision making? Person-centered care and shared decision making is a really critical piece of this whole master's, and it's really then about how you bring the people and people receiving care along with you, and how do you really make shared decisions with people if they have, say, misinformation or disinformation. So that's a kind of a key piece that we think is a kind of a new challenge that people are coming across that we're going to work on as well. Then innovations in healthcare really looks at the role of digital health and technology, artificial intelligence technologies. So what do they actually mean? What's underpinning them? How do we implement them appropriately and safely in our practice? Advancing health equity then. So a big piece of this is about how do we look at ensuring our healthcare is going to be prepared for what the world looks like and an increasing globalized society. And then our final applied project module. So to note, this is a 20 credit module as opposed to a traditional thesis, which is typically 30 credits. So we've done it this way because rather than a traditional thesis where you write something up, it sits on a shelf and never goes anywhere, we want this to be, again, very much applied. So we'd be working towards you coming out of it with something that you can then take to your manager or take to your team and say, look, here's a plan for a problem that we're currently facing. Here's the entire kind of blueprint for how we go about addressing this. So how does it work then in reality? So essentially what the program will look like for you is that weekly content will be released on Canvas, which is the university's learning system, on a Monday morning. Students then will work through that content in their own time. What that content typically looks like is interactive workbooks. So these are kind of workbooks where they kind of guide you through the content. They might have quiz questions. They might guide you to a video clip they want you to look at. And that's essentially what that workbook will look like. Then that's supplemented by discussion boards where we'll be talking with each other, both our classmates and with us, the staff, about kind of your current experiences and how that's reflected in what you're learning. So that kind of asynchronous content that you kind of work through within your own time is then supplemented by a live 2-hour online session that takes place every week if you're doing the course full-time, or every second week if you're doing it part-time. And provisionally at the moment, those are set aside for Wednesdays, so between 7 to 9 p.m. Irish time. So those sessions will all be recorded and uploaded to Canvas as well. So we will be encouraging everyone to attend them, but if for some reason you can't, they will be available afterwards as well. So this is our staff, just to introduce the staff working on it. So as I mentioned before, I won't go through everyone in detail now. You can find this information on our website and our recent newsletter. But everyone here comes from different experiences, different disciplines, different backgrounds. So we have experts from sociology, experts from midwifery, from nursing, from medics, physiotherapy, from health psychology, from engineering, biomed. So it's a very much an interdisciplinary program that's been developed and designed to be that way. So we're really delighted to have worked with some really fantastic people in terms of helping us deliver and develop a course that would be in demand and would achieve our goals. We're very happy to have some really fantastic endorsements from people like Dr. Carlos Wells-Weiser, who's the editor-in-chief of Cochrane, from Mr. Bill Maher, who's the CEO for the Bon Secours Health System here in Ireland, and also Professor Anthony O'Regan, who's the Chief Academic Officer in the CELTA network here in Galway. So just, I suppose, some of the nuts and bolts then. Entry requirements are 1:1 or 2:1 bachelor's degree in a healthcare related field. However, we will consider people with non-healthcare related degrees on a case-by-case basis, depending on things like experience in the field. So relevant work experience in healthcare is important. So including things like, as I mentioned before, both direct care for individuals or communities in clinical settings, but also could be people with non-clinical roles in healthcare administration, policy or research, or community service. And that diverse background is really important to us. So finally then, before I finish up, just I suppose, why do this course? So doing a master's is very beneficial for career progression, for things like pay, increasing promotion opportunities and hiring. The course will facilitate you to go on towards things like dual clinical academic roles, and also facilitate progression towards further research or for potentially PhD programs. It can also prepare people for things like patient advocacy and patient communication focusing roles, and also benefits for the service. So if you're trying to make a case to your manager for why they should support you to come on the programme, it's very applied. So the focus is on evidence-based healthcare and stuff that you can apply in your workload tomorrow. The interprofessional piece of it reflects what our healthcare system looks like, and it's really about trying to improve services, systems, and patient and healthcare outcomes. So for example, it could facilitate you to become like the evidence lead within your team or that type of thing. And then from a personal development point of view, I know I'm biased, but I do think that the content is very interesting and very engaging. We've worked really hard to make sure that it will be. And I suppose just to really help people reflect and improve on their own practice. So just finally then, just to apply through the university postgraduate application system, which is on the website. This is the documentation that you need, and that's all up on our website as well. And just to refresh that the closing date is 31st of July 2024. So yeah, thanks very much for listening, and be very happy to kind of chat with anyone. If you have time to chat now, brilliant. And if not, you can contact us at any time using our email address here. You can also access our website through the link or the QR code here. So thanks very much.
Thank you so much, Elaine. That was really comprehensive, really interesting. So thank you. There doesn't seem to be any questions just yet from what I can see here. If you can see something either, can wait a moment or two. But as Elaine said, you have her contact details and you can ask Elaine any questions if you have them after viewing this webinar. And also if you have any other questions on the broader issue regarding Galway or the university itself, you can ask them on this platform. Thank you, that's great. Okay. Okay, I think that's it. Thank you so much. Thank you both for your time, and thanks everybody for watching. Thank you.
Thanks, everyone.
Have a
Good
good